Did you know that when you're eating can be just as important as how much? Most of your clients will hit a plateau at some point in their journey to reach their health goals with you, no matter how clean their diet is or how consistent their exercise. The question is, what tool can you use to break through it without adding more supplements or getting more restrictive? Intermittent fasting, when applied strategically, can be that tool. I'm going to give you what the research and our clinical experience shows is the best way to maximize the benefits of fasting while making it safe and doable for your patients. The best method that your patient can't follow through on still doesn't get results. For example, did you know that when you're eating can be just as important as how much? That's one of the things we're going to discuss today. Now, fasting is a hormetic stressor. Hormesis is stress that makes the body better if it's done at the right time and in the right amount. As with all forms of hormesis, it should never be a first-line intervention. Before introducing fasting, confirm the client has a nutrient-dense diet, tolerable stress levels, so not perfect, but they're doing okay, stable sleep, and is not over-exercising. Only once all of these foundations are in place should fasting be considered. How do you know if it'd be worthwhile for your client when they are actually ready? Populations with the strongest evidence from the clinical research of benefit include those with elevated cholesterol, glucose, triglycerides, blood pressure, or excess body fat. There's also support for autoimmune disease, and we're going to talk about why in just a second. GERD, SIBO, PCOS, and various neurological conditions, including dementia. Research shows it's much easier to follow an intermittent fasting method than to maintain daily calorie restriction, making it a much better long-term tool for weight management. But beyond weight, fasting supports autophagy and apoptosis, making it helpful in cancer prevention and adjunctive care. But of course, being able to get rid of dying or dead or unhealthy cells is going to be helpful for any health condition out there. It also upregulates the circadian clock genes, improving regulation of the circadian rhythm, which is useful for those with sleep disorders and in clients who travel frequently. But remember, pretty much everything on the body runs on a circadian rhythm. So improving that is going to help all systems of the body. Now, how can it help so many different issues with one intervention? It's effective at removing what causes the body to dysfunction and upregulating what allows the body to heal. This makes it an important tool to address many different root causes. If you want the research citations on all of the benefits I'm about to cover, as well as what I've already covered, check out the description of this video to join our academy and get all the practical research takeaways on any topic you encounter in your practice of functional medicine. Okay, let's dive into the biology of fasting. It reduces oxidative stress and inflammation. This leads to improved mitochondrial and cellular health for better energy production, which means also more energy for your immune system and your detoxification system. It reverses insulin resistance, fatty liver, and even biological aging, according to a standardized formula. As for gastrointestinal benefits, fasting enhances overall motility and the migrating motor complex, or MMC. It improved barrier, in different studies, it improved barrier function, promotes greater microbial diversity, and increases 𝗥𝗲𝘀𝗄𝗃, the new darling of the microbiome now these days. The net result is a healthier microbiome and reduced leaky gut. It also improves immune regulation, such as by reducing CRP and IL-17 while promoting Treg cells. If you'd like a refresher, IL-17 triggers autoantibody production, while Treg cells lead to the destruction of autoantibodies. The result is decreased autoimmunity at the root. To support detoxification, fasting improves liver health, motility of the bile duct, and toxin mobilization from cells, which is phase 1 of detoxification. Not too many other things are able to upregulate that. It also increases BDNF, which is brain-derived neurotrophic factor, which supports cognitive function. It lowers IGF-1, a marker of aging, of overall aging and of cancer, and increases growth hormone, preserving lean mass while promoting fat oxidation and tissue repair. How many things are able to allow you to lose body fat and hold on to muscle at the same time? With all of these benefits, it's one of the best strategies for longevity. Even at 12 hours of daily fasting, that has been shown to promote longevity. Finally, it also introduces caloric variance to avoid adaptive plateaus. When clients restrict calories every day, weight loss stalls. The body adapts to that. Studies confirm that intermittent caloric restriction produces greater fat loss and better insulin sensitivity than chronic daily restriction. This means intermittent fasting is particularly valuable once clients hit a plateau. Intermittent fasting, though, is contraindicated or requires extreme caution in some of these conditions. Anyone who has an active or past eating disorder, anyone who's underweight or borderline underweight, pregnancy and lactation, of course, children, especially at a normal weight, clients on a glucose-lowering medication, especially without close supervision. Women should avoid fasting during the second half of the luteal phase, if not also right before and after ovulation, just depending on the client, since fasting elevates cortisol and can disrupt estrogen and progesterone balance. Very lean women, which would be around a body fat that's below 20%, often have adverse hormonal responses with fasts that are greater than 24 hours. That means elevated cortisol, decreased thyroid activity, ovulatory disruption, and delayed recovery. So I'd avoid suggesting fasting to this population. Clients who undereat chronically or skip meals should not begin fasting until they've made changes in how much they're eating. In these cases, the metabolism is already in a conservation state, and you won't see benefits. We've had obese patients do intermittent fasting 3 times per week for 16-hour windows and not lose any weight after 1 month. Then we discovered they had reverted to their under-eating ways. Instead, first have these clients bring safety back to their body when it comes to food and replete their nutrients with 3 full meals daily for at least 1 month, ideally 2, before revisiting intermittent fasting. Also, carefully consider your patient's blood sugar regulation. Symptoms such as dizziness, shakiness, lethargy, or brain fog during fasting often reflect reactive hypoglycemia, blood sugar swings that outpace a diabetic's adaptive mechanisms, or adrenal insufficiency. Address blood sugar regulation first through nutrition and supplementation before trying a restricted eating window. Okay, now that you know what it can do, who it's for, and when to use it, let's discuss how to do it. There are many variations of intermittent fasting. We have the 5-2 method, which is 5 days of normal eating and 2 days at less than 30% normal caloric intake. It has been shown to enhance fat oxidation, which is burning your body fat, increase short-chain fatty acids, and reduce LPS, which is that toxin that comes from bacteria in our gut that makes the whole body inflamed. We also have alternate day fasting, or ADF, which is every other day, consume 0 or very low calories, typically 20 to 25% of needs. Fasting mimicking diets, or FMD. This is 4 to 7 days of calorie and protein restriction, repeated only once per month. Time restricted feeding. This is eating in a window of 6 to 8 hours. This is what we typically think of when we say intermittent fasting. OMAD, which is only, or 1 meal a day, is one version of time restricted feeding, but research shows it leads to worse lab outcomes, worse sleep, protein intake, and muscle preservation. So it is not recommended. Meta-analyses suggest all of these approaches are effective, with alternate day fasting often showing the largest effect sizes for fat loss. Regardless of the method, emphasize that non-fasting days must meet caloric needs to prevent maladaptation and limit the stress on the body. Remember, this is hormesis. It's a little bit of a stressor. If you do too much of it, it's counterproductive. At our practice, a 12-hour overnight fast is our clinical baseline. Then we bring in 16/8, typically, intermittent fasting, as needed, and when the timing is appropriate for that client. If there's more advanced dysfunction and the client would benefit, we'll use the FMD or ADF based on their preferences. The client's like, I'd much rather do this versus that, and based on their goals, once they're tolerating the intermittent fasting well. Only after that. For intermittent fasting, men do well with 4 to 5 days per week. Women do best with 2 to 3 non-consecutive days per week, especially if they're still cycling. While postmenopausal women may see benefit with up to 4 days weekly. We have a little bit more resilience once our hormones are no longer fluctuating to small stressors like fasting. For the duration, the general starting guideline is an 8-hour window, and progress to 6 if it's tolerated. The patient's like, yeah, this is really easy. You might get a little bit more benefit with a smaller window, but just don't go below 6 hours. 2 meals plus a snack is an optimal way to get your food in during that window. Data shows 1 meal per day raises fasting glucose, worsens your morning insulin response, so you're gonna be having a higher glucose response to carbohydrates in the morning, increases blood pressure, and elevates cholesterol compared to 3 meals per day. If your client is a reactive, stressed, very inflamed and or complex case, you know, what kind of patient I'm talking about. They're just someone that's, you've got to be really careful with a lot of things you're doing with them. It could be wise to actually just start with a 10-hour eating window and work towards 8 hours over the course of a month if the 10-hour is well tolerated. There's no race here to reach that 6 to 8 hour window. They could literally do 10 hours, then 9.5, then 9 down to 8. Okay, we're getting to the end here, and I saved the best for last. So now to the controversial topic. Everyone online talks about fasting by skipping breakfast. But the research is very clear that timing significantly impacts the degree of benefits. Earlier windows outperform late eating windows every single time. An 8 a.m. to 4 p.m. or 9 a.m. to 3 p.m. schedule improves sleep, glucose, and lipid panels to a much greater degree. Skipping dinner lowers nighttime cortisol and increases growth hormone, supporting muscle retention, which is all good things. We want cortisol to be low at nights. Skipping breakfast lowers morning cortisol and worsens HPA axis dysfunction for the whole rest of the day, regardless of when the patient eventually eats. Each 10% increase in calories after 5 p.m. raises CRP by 3%. In contrast, longer nightly fasting reduces CRP by 8%. Nighttime fasting for greater than or equal to 13 hours is associated with about a 30% lower risk of breast cancer. Prostate cancer risk is lowest in men who fast overnight with early breakfast eating time. Finally, data from a crossover trial. Skipping dinner increases energy expenditure by 91 calories per day with improved insulin sensitivity, whereas those same people, when they were skipping breakfast, it increases energy expenditure by only 41 calories per day, but worsens insulin resistance by 54%. If that wasn't enough to convince you, please check out our academy for more. So to summarize, optimize fasting by using an earlier eating window, 6 to 8 hours in length, 2 to 3 non-consecutive days per week for cycling women, 4 days per week otherwise, with sufficient protein spread across 2 to 3 meals. Okay, there you have it. Intermittent fasting, just like everything in functional medicine, is incredibly powerful when it's adapted to the individual client's unique needs. By screening for readiness, matching the method to the client's physiology, and monitoring how they do, clinicians can use intermittent fasting to improve metabolic health, reduce inflammation, optimize their circadian rhythm, and support long-term resilience. Thanks for taking some time out of your day to learn so you can be a better clinician. Be sure to subscribe for some more evidence-based strategies in functional medicine.